from Palmer College Chiropractic. We're in San Jose, California, and I will be presenting on the chiropractic profession itself. Oops, went a little too soon on that one. There's a couple of, there we go. Can everybody see my big purple screen? I'm going to take that as a yes.
Yes.
Awesome. So chiropractic medicine. I'm going to start with a movie because it kind of gets everybody in the mood and only takes a couple of minutes. Excellent. Thanks, guys. So this handsome devil here is Dr. Daniel David Palmer, the founder of chiropractic and the chiropractic profession. In the 1880s and 90s, he was doing physical medicine and was greatly influenced by the rapid industrialization of the American Midwest at the last part of the 19th century. So, farming was becoming more and more automated. Factories were popping up. There were really no safety protocols. Initially, child labor was common. People worked very long hours. And a new kind of injury, the industrial injury, became more common. And these are often crushing sorts of machine injury, where spinal injuries became quite common. And the kinds of paralysis and permanent disability that came with these spinal accidents, Dr. Palmer started to see a correlation between these really terrible effects and more common things people were complaining to him about at the time. And I would argue even now, back issues were mostly treated as a pain issue unless they were really bad, such as a broken back. And at that point, no one could argue that it was a systemic issue. The patient can't move their legs, that's motor. The patient can't feel anything, that's sensory. The patient's likely going to be incontinent based on the area of the injury. There's organ function. And Dr. Palmer decided that there was likely going to be symptomology down each of these pathways, even if you didn't have a terrible break or cord shock or a dissection or this kinds of thing. Even if there was chronic interference in the spine, wouldn't you also expect symptomology? So maybe the patient is not paralyzed, but has affected movement. Maybe the patient's not incontinent, but based on this injury or interference, has an effective organ function. And that's the direction that he took his later work. Eventually, he opened Palmer College of Chiropractic in 1897. That was the first chiropractic college in the world. And now the chiropractic profession has 18 schools of chiropractic throughout the United States, 2 in Canada, several in Europe and Japan, Australia, and New Zealand. But these days, we find ourselves very squarely in the pharmaceutical route to health. 60% of us take at least one prescription drug each day, and a full 15% of Americans are on 5 or more medications a day. In fact, the amount of prescription drugs has increased 85% over the last 2 decades, where the American population has increased about 20%. And so there's definitely, we definitely have the most modern and the most expensive healthcare system in the world, and yet we don't really have the healthiest society in the world despite our access to medicine. So where is that disconnect between the healthy host and our access to medicine? Chiropractic tries to answer some of these problems as a profession. The most utilized over-the-counter medications these days are still ibuprofen and Tums. If you look at what Americans are buying for themselves, everybody's walking around with body aches and a bad stomach. Your chiropractor may actually have some explanations for why this is so. You may have seen a similar graphic to this, perhaps in your own physician's office or otherwise. And it's worth noticing how many digestive processes are innervated out of the lumbar spine. So the same mechanisms that may be causing low back pain, which might draw someone to use ibuprofen, those same mechanisms are affecting, as Dr. Palmer theorized, many, if not all, of the nervous functions that come out of that part of the spine, many of them adding or promoting to our digestion. So it does surprise a lot of people that have chronic low back pain, that when they finally go in for treatment, their stomach issues tend to clear up as well. It does not surprise their chiropractor, because the spinal cord is very well mapped. We know what parts of the spine innervate what organ function. And so besides the pain issues that many people think of when they think of their chiropractor, your chiropractor can actually help with many full body issues with a neurological cause. But getting to what most people think of when they think of chiropractic, neck and back pain, 63% of US adults have had neck or back pain significant enough that they needed to see a professional. This is not ibuprofen country anymore. This is, I can't get off the floor. I can't raise my head off the pillow because of my whiplash injury, something like that. And you know that low back pain is the #1 cause of disability on earth. More hours lost to low back pain in the military, police and fire, even mom at home, than any other single cause. So it's also the #2 cause of chronic pain, second only to cancer. So even if low back pain was all we did, this would still be a very necessary and noble profession in the area of societal health. And look at all the cool full body neurological things we get to do too, though. So at its core, chiropractic is a profession that focuses on the spine, and other joints of the body and their connection to the nervous system. Okay, so unlike many kinds of physical medicine, like physical therapy or massage or even DO, which are very musculoskeletal, chiropractic's neurological component means we're working more with systems than only the spot care that musculoskeletal care gives you. Chiropractors use adjustments to restore joint function and support the nervous system. And the major difference between chiropractic and other forms of physical medicine is in fact the chiropractic adjustment, a high velocity, low amplitude, specific controlled force applied to a joint to restore proper function. That is the great crunching that you have likely seen in person or on the various YouTube videos that are out there these days. Chiropractic scope of practice encompasses much more than just adjusting, however. Chiropractors are primary care and primary contact professionals. We are mentioned by name in the Affordable Care Act, and our closest relative in the field are like dentists. We are just like dentists for your back. So besides chiropractic adjusting, we can do all of the soft tissue therapies, physical and physiotherapy, rehab, and exercises. We can take and read our own x-rays. We're also very interested in helping the environment of our patients, environmental care, so full like patient care. We're going to advice, nutritional recommendations, things like that. And you know, we're doing a really good job at what we do. 95% of our patients have found our treatment successful. 89% would recommend us to their family and friends. I guess we should take a moment to feel sorry for that 6% of people with no family and no friends. But we are also doing these things very safely. So these are some interventions you can do for your musculoskeletal issues, your spinal issues, and your chances in a million of their killing you or leaving you disabled somehow. So where are the surprises? Well, over here on the left, spinal and cervical surgery, that's major surgery. That is, you know, general anesthesia issues, secondary infection issues, you know, the kinds of big numbers you'd expect with major surgery, right? For me, when I first saw this chart, the two surprises were the 153 people per million who were being this badly injured by their NSAIDs, and the about 1 in 5.85 million people who were injured this way by chiropractic treatments. And yet, when you hear these things, the hyperbole is always the other way. Always that fear of stroke or your chiropractor is going to hurt you. When the statistics show that twice daily a leave is actually 800 times more deadly than chiropractic medicine. And yet, if you, I mean, please tell me you don't watch Dr. Oz, but if you do, he had an entire episode dedicated to what to know before you see your chiropractor. So I'm going to pause just for a moment to give a public service announcement about tech neck. Tech neck is hurting people. Our bodies are engineered to look around, primarily straight ahead and up. But these days, we have our heads locked down, looking at our technology, typing, checking our phone. And the more hours you spend that way, just 15 degrees almost triples the weight of your head on your shoulders. And it gets worse than that. Usually people are, I'm usually in here. You know, I'm not cool this way. I'm usually in here. And then by the time you're out here, you probably also need glasses in addition to what you're doing to your neck. This is the proper curve of a neck, which is this way, and it acts as a shock absorber for this weight over your shoulders. But once you start to get a reverse curve on your neck, you don't have that shock absorber anymore, and you are subject to herniated discs, headaches, and the start of degenerative disc disease, which can lead to disability further down the line. So please take a moment to look up from your technology. Um, you know, if you've had a particularly long study session, it might be a good idea at the end of the day to roll up a towel, put it on the back of your neck, lay down on there for 15 minutes, kind of get that curve back into your neck. It's going to save you a lot of trouble and hardship in the long run, because tech neck is hurting people, and not just because you're wandering out in front of cars, and people are, but just the act of keeping their necks this way for extended periods of time is really bad for you. Moving on. This is the curriculum of a modern doctor of chiropractic. It is the curriculum of a primary care, primary contact physician. Um, you'll notice it's broken up into year 1, 2, and 3. Chiropractic, a doctor of chiropractic degree is a 4-year degree, but all but one chiropractic college in the United States has moved to a year-round calendar. In Palmer's case, it's a year-round quarter calendar. There are trimester systems out there, but most doctor of chiropractic programs you will finish in 3 calendar years because you go through the summertime. So since that's the norm with every chiropractic college except Bridgeport, Connecticut, we've put it in that format here. As you notice from the film, chiropractic is growing. It's growing about 10% faster than the average for all. So the average for all jobs is about 7%. The average for chiropractic is about 17%. That's the 10% growth that they mentioned. The number one in job security that they mentioned in the movie is from Market Watch magazine. That's a business magazine that rated 100 careers and put chiropractic number 1 in job security. The article actually said there are virtually no unemployed chiropractors. And this, according to salary.com, are national averages salaries for a medical doctor, a doctor of chiropractic, nurse practitioner, your DOs fall into this next category as well, nursing and physical therapy. So chiropractic has a potential for very competitive salaries. Please do not choose a healthcare career based on salary. It will never be enough. You really must wish to dedicate yourself to the health of others, or any healthcare job is going to be a terrible one for you. But if you are that sort of person and would have been afraid to approach chiropractic, wondering if you'd be able to make a good living, then you don't have to worry. If you were thinking, hey, I'll just go into PA school and I'll be fine, or I'll go into nursing and I'll be fine, especially PT, then you will absolutely be okay, be able to pay back your student loans and offer a good standard of living for you and your family as a chiropractor for sure. Some of the reasons people come to chiropractic are to help build the healthy communities of tomorrow. This country is suffering from quite a bit of issues with opioid dependency and opioid addiction for that matter. You know, chiropractic is very effective in treating chronic pain, and there are several moves already to make physical medicine your first stop before being prescribed opioids. I believe in the state of Ohio, it is that workman's compensation needs to have certain many weeks of physical medicine before the opioid tracking disability can be given. So this is trying to help us break that cycle and literally help build the more healthy communities of tomorrow. Chiropractic is not nearly as expensive as many kinds of healthcare programs. We're nowhere near as expensive as medicine, DO, pharmacy. And yet, at the other side, we are primary care, primary contact physicians. And so, you know, it is a really good return on your educational investment. if you're shopping frugally, shop chiropractic. It is a chance to be your own boss. Chiropractic is one of the few areas that still has some autonomy in healthcare. Most other kinds of doctors really do have some sort of administrator from Kaiser telling them exactly how many Saturdays they're going to work. This does not have to be your story. Your office can still be an extension of you and your patient's values. So if you wish to be an entrepreneur and be your own boss and yet also be a doctor, this is a really good choice for doing so. And along that lines, enjoying a very satisfying work-life balance. You know, the complaint in medicine is so often the sacrifice that you must give to the career. Um, you know, dad's never home, mom's pulling another midnight shift at the hospital, these kinds of things. And with chiropractic, your chiropractor is really making significant improvements in their patient's quality of life, and yet is home for dinner every night, because chiropractic is quality of life and performance care and tends not to be the kinds of crisis care that medicine is. So, you know, nobody, as awesome as we are, you know, nobody dies if they have to wait until Thursday and not Monday for their chiropractic treatments. You tend not to be paged out of bed at 2 a.m. because that's when the babies come. And so you'll get a chance to make these as significant improvements and still be there and not necessarily have to give up the things you love, an art form, a sport, being there for your kids, etc. The healthcare chiropractic is a career with lots of options. The most common, as I've mentioned, being an independent practice. 70% of chiropractors are in or actively moving toward a private practice. Chiropractors work in a group practice where they're one of several. A team kind of takes some of the pressure off the individual doctor to make everything work. Many chiropractors work in a multi-specialty health group, such as a sports clinic or a holistic health center, where you might have multidisciplinary kinds of care offered in one place. Research or teaching is another way that chiropractors go. This is often a way that people get their practice started. Sometimes they will teach part-time while they build their practice part-time. You can teach in a chiropractic or other healthcare. You could teach anywhere, but mostly they'll want to pass on their knowledge to another kind of healthcare school. Hospital staff, especially veterans and military hospitals. There are 4 chiropractors working at Walter Reed, for example, but also the kinds of hospitals that give the omni care. For example, most of the cancer treatment centers that you see commercials for on television have chiropractors on staff, and the patients getting the omni care. They're certainly getting their cancer care, but they're also seeing a nutritionist, and they're also seeing a psychologist, and they're also seeing a chiropractor to try to mitigate some of the harm that many of these medications do to the nervous system of these patients. Corporate chiropractic has become very popular these days. All of the big companies that you're thinking about, the Googles and the Yahoos and the Facebooks and the Instagrams, they that offer all these awesome employee services, the free daycare and the cafeteria and the napping pods. Very often they bring healthcare, especially very portable healthcare like chiropractic, into there. If here's your chance to work for Google, if you wanted to as a chiropractor, you can do that. And then one of a myriad of specialty practices as well. And a lot of people think of chiropractic as general family care, and much of it is. But you know, a lot of chiropractors do have the special and extra education to move into pediatrics, geriatrics, nutrition, radiology. That's probably more better described as diagnostic imaging, because at that level it also includes MRIs. Hardcore neurology, internal disorders, women's health is not mentioned on here, but that's one. And where we have found a particularly enthusiastic welcome is in the area of sports chiropractic, sports medicine, sports rehabilitation. And it's not only the kinds of issues that you think about. You know, we can help with things like shin splints and sports hernia, hamstring sprains. It's not just that kind of thing, but also performance care. You know, this is not necessarily just a response to trauma. Chiropractic can help fine tune an athlete for a particular event. That's why 90% of world-class athletes use chiropractic care as part of their healthcare and training regimen. One of my favorite stats is here on the bottom right. Just 12 weeks of chiropractic care has been shown to increase hand-eye coordination 30%. That's crazy. Think about that right before Serena Williams launches a 110-mile-an-hour serve at you. Um, that's good to know that your quick twitch can be fine-tuned like that. In the movie, you probably saw the picture of Dr. Miller there standing next to old man Tom Brady. I know he's still in the old Patriots jersey. We're working on a Tampa Bay jersey, but you know, chiropractic is part of almost any professional sports team you may want to mention. And yet, for all of the cool things about chiropractic, our admissions requirements are actually quite modest. You need at least 90 semester credits of college coursework. That is 3 years full time. On a quarter system, that would be 135 quarter credits. Of those credits, 24 semester credits must be sciences. That'd be 36 on a quarter calendar, with anatomy and general chemistry specifically included in those. And those are really general because people come to chiropractic from different sorts of majors. Kinesiology, exercise science is the most common route, but plenty of people come to chiropractic through your more classic kinds of pre-med, biology, physiology, health. People, they've had that moment with their doctors. Wow, chiropractic's awesome. I want to do that too. And even if they have a business major or such like that, they can beef up on the science portion of their curriculum to come into chiropractic medicine. You need a GPA of 3.0 or above. There is no GRE or MCAT requirement. Gosh, Bill, why is chiropractic education, why are the requirements much lower than I'm looking at medicine or pharmacy and things like that? Really, it's because we have not suffered from the academic inflation that is so common in other kinds of programs. Usually this pharma program, that dentistry program, they are one major, one program in a much larger university. Maybe they'll take 50, 60, 70 students once a year, and you really do have to fight for that spaces. Most all chiropractic colleges are private, dedicated colleges. With the example of Palmer, that's all we do. And so even our school in San Jose can take in up to 75 students 4 times per year. So when that's all you do, when the seats are available, you don't have to fight nearly so hard to get into them. And so, you know, we have kept our requirements. The US has kept our requirements to that which is proven to show success in the program and then success in the field of chiropractic medicine. So please do consider chiropractic as a career. If you are motivated to help people and you would like to work in a field where you can honestly make a difference, you know, chiropractic issues are quality of life, mobility, performance issues, and as I mentioned earlier, tends not to be the kinds of crisis care that medicine has. So these are the kinds of things that actually can be treated, that we expect to bring our patients to pre-event status. And that is so rare in medicine these days. You know, we're gonna manage your congestive heart failure. We're gonna treat your diabetes. So few things just go away anymore. But in chiropractic, people will be carried into your office who later walk out. And that's a great feeling, not just for them, but for you. Being able to make that positive change right in front of your eyes gets you up in the morning ready to do the same thing tomorrow. You can change lives and be appreciated by your patients. I don't know how many of you have sought chiropractic care yourself, but going to your chiropractor is more entering into a partnership for the sake of your health. It tends not to be quite the passive healthcare that, say, dentistry is. And therefore, doctors of chiropractic tend to be considered more kindly, I'll put it maybe, in their patients' hearts than say going to the dentist or things like that. It's a chance to give back to your community. Chiropractic is very portable. We don't, there are specialized tables and stuff, but there's not a lot of machines, equipment, etc. that we really need. Our hands are our basic tool for helping people. So literally 2 hands and a flat surface, we can change our patients' lives. That means it's not hard to show up once we're established, maybe do free exams for the high school baseball team, maybe do concussion protocols for their football team, maybe visit a homeless shelter for some people who maybe have not had health care for months or years. This is an easy way to give back once you are a licensed professional. Maybe you're interested in something a little more natural, something more non-invasive, something more holistic in your approach to healthcare. This is a very powerful healthcare option. Bioneurology is a very powerful tool for recovery and optimization of your patient to resist disease and injury. And it does not rely on medication. It does not rely on surgery. We are not the least bit anti-medicine. We are, however, this profession does not utilize drugs or surgery. And so if you're looking for a way to help people that kind of gets away from that, maybe you have seen one too many of those pharmaceutical commercials on TV where the last 30 seconds are all the ways that this medication is going to kill you or make you want to kill yourself. And you're thinking, I'd love to be a doctor, but that bothers me. Please look into chiropractic because it is primary care and primary contact and tends not to have those issues. Maybe you've had an enlightened experience at your own chiropractor's office. A lot of people go to chiropractic and they get great care and they love their doctor, and it never occurs to them, hey, you could do that too. But UCLA is an awesome school and there to prepare you to be any kind of physician that you'd wish to be. And if it had not occurred to you to do likewise, I'm telling you, you can do likewise, and it's a great profession. Maybe you want that chance to set your own hours. Maybe you are looking for that positive work-life balance. Maybe, you want to have kids someday. Maybe, you sing or play an instrument or do a sport, and you don't want to give that up necessarily. As I mentioned before, you don't necessarily have to with chiropractic. And then, of course, that almighty buck, the positive return on your educational investment, time and money. I'm not the first person that's talked to you about your student loans, but this is a great and worthwhile profession that you don't necessarily have to break the bank to be a part of. So what can you do next? Well, you can virtually visit a campus. We have our virtual campus visits. I think most chiropractic colleges do. So it's not just Palmer. You can kind of see, have a look around from the comfort of your own home these days. You can visit a doctor of chiropractic in your area. Even if I have not convinced you to be a chiropractor, perhaps I have empowered you to see a chiropractor for your spinal and full body issues. Chiropractic is essential services, and chiropractic offices are open the way dentist office and doctor's offices are open. You can visit our website specifically, and I would love it if you did, or connect with an admissions representative. This is my contact number right here. However, at this point, I would love to bust this open and answer any questions that you might have. Stop with the prepared things and maybe talk to you about what your questions or concerns might be.
Thank you so much, Bill, for the presentation. I learned a lot too.
Thank you.
Since we are a small group, I'm gonna have the attendees, I'm gonna give you the option to talk if you want, or you can put your questions in the Q&A if you have any. All right, so I have one because I found something surprising that you
Okay.
mentioned that chiropractors can address nutrition and weight loss. How
Yes.
common is that? Because I know people go to uh, chiropractic doctors for pain, but I've never realized that you can go to them for weight management.
Oh, absolutely. Because I mean, we're trying for a whole patient approach. I mean, we could adjust someone every week while they smoke themselves to death. I mean, what really good are we doing for them, right? Um, More specifically, your weight has a great deal to do with your body mechanics. If you have a spine that is meant for a 135-pound person, but you are a 175-pound person, that can really hurt with the aches and pains. Um, Early things like arthritic conditions and otherwise. So part of your rehab, part of your homework that we're going to give you is to make sure that your body mass index more closely matches, um, for the sake of your skeletal health. And the same thing really goes for nutrition. We are what we eat, and it's one of those things where your support, your immune system, everything runs off the fact that you're going to have to give it the best stuff to build things with. And again, a hamburger and a hot dog diet is not going to do that. And there are going to be physical traces when someone has a poor diet or their body mass index is not what it should be. So these are two very common areas the chiropractors are going to try to help with to maintain a healthier host.
Thank you. That's good to know. Um, do you know how often people turn to chiropractors for weight management and stuff?
Initially, they likely don't. Usually, they're going to come to chiropractors. It's unfortunate, but we're the pain guys. When really, we would much rather be. I mentioned how closely related we are to dentists, and this is true. We're just like dentists for your back. Um, the doctor-patient relationship is very similar. We have a specialized area of care with ramifications for greater body health, just like the dentist. We would rather see you in the good times. Pain is the last thing that happens. There's a whole syndrome of conditions started with restricted movement and posture, which eventually leads to pain issues that we could really nip in the bud if we saw you earlier. So very similar to dentistry, we would like to see you in the good times before you're in pain, because we could keep those bad times away. However, if you're already in pain and then you come to see us, there's going to be some work to do. And that work might be a little bit uncomfortable, just like the dentist. So rather than the weight management you asked, it's generally when you come in for an appointment, we are trying to optimize your spinal health, skeletal health, body mechanics. And now we say, some of the issue is that you're walking around with more weight than you probably should. Have you tried this? Have you tried this? Just getting up and moving is going to help with some things. Sitting is the new smoking. If you've got a desk job like me, you have to make sure you get your um, environment more ergonomically correct if you can. Get up a few times an hour and walk around. These are the kinds of recommendations we're going to be. I kind of touched on those a little bit with my digression about technique, but this is the way that we'd really
Mm-hmm.
try to help the whole patient.
We have some questions. So the first one is, do most chiropractors have high income because they are self-employed?
That certainly helps. Doctors, primary care physicians tend to be well rewarded for their jobs. Um, but so even chiropractors that are on a salary will tend to make a comfortable living. But your highest salary potential is absolutely going to be if you own your own practice, um, because at that point, um, it's all you. It's don't do this for the money, as I mentioned before. We're not making plastic surgery money, right? but it is a very comfortable living. It's above the usual level for a PA, you know, well above nursing, that kinds of thing, because they are primary care and primary contact physicians.
And Marisa has some questions about Palmer's admissions and application process. So Marisa, feel free to unmute yourself and ask the questions live.
Hi, Marissa.
Hi. Can you hear me all right?
I can hear you just fine.
All right. So I guess the first question that I had was mainly about things that you guys would typically look for in admissions, because I know that, for instance, you know, med schools, they look for clinic hours or like shadowing hours and such like that. I was wondering if it would be similar for the admissions and application process.
We would like you to have some experience with chiropractic. If you've not been a chiropractic patient yourself, perhaps do some shadowing hours, that sort of thing. We do not have a specific amount of hours we need you to document. What we really want is to make sure that you know the difference between us and other kinds of physical medicine. It's surprising still that people don't really know the difference between chiropractic and PT, really know the difference between chiropractic and some kinds of massage therapy. So we just want you to know that, you know, the profession you're getting yourself into, I guess is what I'm trying to say. But you don't need to market yourself nearly so heavily for chiropractic as you do for medicine. You know, with many med schools, you need a 3.9 and a letter from your congressman just to, you know, get your foot in the door. And, you know, I get this asked all the time when I'm allowed to come places in person pre-COVID. I'd be, you know, people visited my table at college fairs. It was all about marketing. You know, what do they want to see? Should I join this club? It says 50 volunteer hours. Should I do 150? What do they want to see? And that's because there is access, because we have seats available. You don't have to market yourself so hard. And admissions is going to focus a lot more on you. It's going to be, why do you want to be a doctor? Why do you want to help people literally with your own two hands? It becomes a much more personal admissions thing, and not just this matter of the thousands of hours of this other stuff that had nothing to do with me and my desire to dedicate myself to the benefit of others. So I believe that you're in for a much different admissions process in a Doctor of Chiropractic program, and I think you'll like it.
Thank you. Definitely answered my question with that. My other question was, I've talked to my chiropractor as well as one that I worked under a little bit.
Oh, nice.
They actually all attended Palmer, which is probably why I'm most interested in it. I had my chiropractor recommend that I apply this cycle, so like by the end of my spring quarter, so that would be next quarter, for the fall of 2022 admissions. I was wondering if you had any like comments or recommendations about whether or not I should.
Christina, you don't mind if I talk about just Palmer specifically, do you?
Of course not. Go ahead.
Okay. So Palmer accepts students 4 times per year. You can begin our Doctor of Chiropractic program in any January, April, July, or October. And we would like you to apply at least 6 to 9 months before your intended start date. And we would like you to apply somewhere between 9 months and a year before a fall. Fall is our most common, most popular term. That is October for us. Most people will apply as they begin their last year of undergrad. Certainly by Christmas break, okay? Give us that 10 months. And I know that you will not be done with your classes when you initially apply, but most of our prerequisites are going to be in your earlier years anyway. Your GPA is not going to change significantly in that last semester. And so what you are going to end up doing is you're going to end up sending 2 transcripts, one to get you accepted into the program. We would love to lock your space in nice and early so you can plan your move and all that kind of stuff. And then when your degree posts in spring, you'll send a final official transcript. Hopefully, you know, you're already more or less accepted to the program by that time.
Thank you so much.
Any other questions? If not, I have one more. So sports medicine is very attractive to a lot of people because they enjoy sports, they like being around athletes.
Yes.
And I know that, as you mentioned, a lot of chiropractors aid sports teams.
Yes.
So what would you say to people who are interested in sports medicine or working around sports, and they are debating between becoming a chiropractor or a physical therapist or go for a sports med degree?
Okay. Physical therapy is awesome. It is. I'm not the least bit anti-PT. It is one of the spectrum of healthcare available in the U.S. in physical medicine. Okay. Physical therapists are not primary contact, primary care physicians, and they tend to be part of the support team run by a physician of some sort. And often in the case of sports medicine, that's the chiropractor. And so it's a slightly higher level of physical medicine with a broader scope of practice. You know, that does not make it better. It makes it very different. Chiropractors are going to be more like the head of the physical medicine wing, and there will probably be, so there may only be 1 or 2, and then the physical therapists are going to be that support team, so there's probably going to be 5, 6 physical therapists on that support team. So it's kind of what you want your responsibility to be. And, you know, and then there's levels of that. You know, there's your ATC folks, you know, and then there's the physical therapist folks. And depending on your level, there's your masters and your DPTs, and then your chiropractors. And all of that's going to be overseen by the orthopedist who's there, you know, because on sports teams, they have no problems operating. They'll operate you on you in a second, right? So it's always that kind of conference. What can we accomplish with physical medicine and how fast? What can we accomplish with surgery and how fast? The PT has the advantage of working on both sides, which is to say, if we're going to conquer this with physical medicine, we're going to have the support of the PT. If we're going to do this with surgery, we're still going to need post-surgical support from the PT. The chiropractor is going to be in charge, but they're going to be in charge of that physical medicine wing, hopefully keeping the athlete out of surgery. So you just kind of know your job description and where to go from there. That would be my advice.
Thank you for that.
We are having, now that you mention it, a specific sports function. If either of you are interested, I would invite you to go to our website, palmer.edu, and look for Spines and Sports in Motion. That's going to be next week on the 23rd, where we're going to have 2 sports doctors do a quick webinar like this, specifically on sports medicine, if that's either of your interests.
Thank you very much. One more question from me. You mentioned all those specialties that chiropractors can be involved in. Do you need to specialize? Do you have to do residency or anything like that?
So it really depends. When you come to a chiropractic program, like when you graduate from Palmer after our regular 3-year program, you are ready to begin practice. You know, it's family care, your GP, general practitioner kind of chiropractic. And that's the most usual kinds of chiropractor, come one, come all. Your weekend warriors, kids, moms, fell in the shower, that kind of thing. Some chiropractors will do the extra education that it takes to specialize, and that does come with extra education at various levels. Pediatrics is one that requires an additional year of education. Diagnostic imaging is a year and a half more education. And these are really specializing. You know, if you're a chiropractor in a family practice, you will be adjusting children. But if your practice is focusing on newborns, now you've got a spine, it's this big. You know, there's going to be some specialized techniques you need to adjust that patient. You're going to have to be good on developmental issues, perhaps autism, failure to thrive, latching issues, developmental milestones and childhood diseases, colic, childhood fevers, and these kinds of things, and your chiropractic and neurological approach to these issues, and when it's time to refer to a medical professional. So you do not need to specialize, but those doctors who do find a lot of reward in that specialized program. My own daughter, if I could share a personal anecdote, my daughter Shan is on the autism spectrum, and she was very late walking and such like that. And we were having lots of soft muscle tone issues. And we noticed a very rapid improvement in those kinds of conditions when we put her under chiropractic care under specifically certified pediatric chiropractor. So these kinds of specializations can be very powerful. Most chiropractors stay with general practitioner care so that they don't limit their patients. The ones who do specialize, they love their target audience: sports, rehab, pediatrics, you know, hardcore neurology. And if you fall in love with one of those areas, why not pursue it to the end?
And those specialization would take place at Palmer, right? The additional.
Yes, but you don't have to. They can be gotten at most chiropractic colleges, and even if you are a Palmer grad, you can still get your continuing education at any accredited chiropractic college.
Thank you so much. That clarifies a lot for me. And we are almost at time. So I really want to thank you for spending an hour with us today. And thanks.
Oh, it was fun.
Thanks, Alan and Melissa, for joining us. And yes, we look forward to seeing you again.
Thanks, guys.